Hello and welcome to Esri Fire and Emergency Services webinar series. We use these webinars to promote the use of GIS and technology in the fire and EMS service, and we're happy to have you for our GIS to serve communities for pandemic response and recovery. We're joined by a pretty esteemed group today. We'll have the Chief of San Bernardino County, Dan Munsey, speaking about their response to the COVID pandemic, and we also have Deccan International with their staff to talk about how they can help address some of the obstacles and issues that have arisen during this response to this pandemic. A couple of housekeeping issues. We will be recording this and it will be available online after the webinar. We will have an email that goes to all attendees and registrants with relevant links to content and resources that you may use during your response to the COVID crisis. And there's a chat window that you can submit questions during the webinar that we will follow up on towards the end of the webinar and try to address your questions as best we can. I am Mike Cox. I'm your Director of Fire and EMS Industry Solutions. I like to refer to myself as the Fire GIS Liaison for Esri. I come to you after 27 years with the Henrico County, Virginia Division of Fire, where I retired as the Deputy Chief. We're also joined today by Deccan International. Their group is led by Jack Brightfield, their Vice President. And Jack, I'll turn it over to you to introduce your staff.
Good morning, good afternoon, everyone. My name is Jack Brightfield, and I'm the Vice President of Sales for Deccan. We have three of our project specialists joining us today. We have Jamie Schwartz, Mike Mosier, and Alex Thames. And we're honored to partner with Esri today for the webinar. We've been in a relationship with Esri for decades. So Mike, thanks for having us.
Yes, sir. So glad you're here. Deccan's one of our great public safety partners and is working with Esri for a number of years. So they have some wonderful solutions for fire and EMS agencies. And our special guests today include Chief Dan Munsey, as I mentioned earlier, San Bernardino County Fire Chief. Many of you may know Dan. He was a hero of ours in promoting technology in the fire service and actually started the Cal Chiefs Technology Summit that was held on Esri's campus for the past couple of years. And the operations committee that he was the chair of really educated the fire service internationally on best cases, best practices to adopt technology in the fire service. And he's joined today by his Deputy Chief, Kathleen Opliger, who is one of the unified commanders for San Bernardino's regional COVID response. So Chief Munsey, I'll turn it over to you if you can describe the challenges you faced and how you address them as an incident management team concept and supported your community. So Chief, go ahead.
Good morning. As you alluded, I have our interim Deputy Chief, Kathleen Opliger. And Kat is just absolutely amazing when it comes to operations, having spent many years on a variety of teams, both Type 1 and Type 2. She is our incident commander for our Type 3 team in the county of San Bernardino and did a wonderful job taking that San Bernardino County Fire Incident Management team and moving to interagency as we've faced COVID. So I'll have her jump in a time or two. A little bit about our county. We're the biggest county in the United States. We cover about 20,000 square miles. In perspective, you can take the 6 small states in the union and put it within our borders, and we would still have more area. COVID, as you know, is borderless. It's without jurisdiction. It affects everybody independent on their status or their gender. And we very quickly realized early on that we needed to plan not only for our county, but assist some of the smaller jurisdictions around us, including some of the cities. We stood up our incident management team fairly early on with the mission of ensuring that our personnel would have the proper PPE, that we'd be able to continue that supply chain, recognizing that we were going to have to alter our current operations and directives, and understanding there's going to be a good deal of training to train the organization. Chief Opliger was tasked to do this and immediately assumed the role, assembled her team, and started operating. I turn it over to her to discuss a little bit about the first couple of weeks and then moving that to interagency, and then I'll finish off with some of the technology that we use in the county of San Bernardino, but also describe some of the technology that we're seeing throughout the region and the nation in combating COVID-19.
Good morning, everybody. Kat Opliger, I'm already introduced as who you have me being. Thank you. So early in March, we, as a district, recognized the need to address many aspects of COVID, most importantly, the degradation in the workforce due to illness. So we stood up early in March and started dealing with PPEs, planning for system-wide degradation, planning for the EMS delivery, fire service delivery, etc. It became apparent to us very early on that none of us could do it alone, even a department our size. So we reached out to the operational area, which encompasses 18 or 19 of our local fire department cooperators, as well as AMR, ISMA, public health, and so on, and put our heads together. We expanded the team to a unified command concept, like you mentioned, brought in the operational area coordinator as one of our unified ICs, as well as ISMA, really looking at what stakeholders we needed to bring in to leverage all of the things, leverage their reach, if you will, all the reach that they had to help us get things accomplished. Again, with the main objective being continuing to deliver fire, rescue, and EMS services countywide without regard to jurisdiction when the workforce degraded. And then, of course, we morphed into, over time, assisting our hospitals in the county with planning. We helped with the skilled nursing facility blooms we saw, also with countywide testing, standing up the field treatment sites in the alternate care centers, or I should say alternate care sites and field treatment centers, working alongside of OES, who also did a great job with that. So I won't go into it too much, but we used a ton of technology to both what we had and what we needed moving forward to manage the incident. We brought in GIS specialists, worked on with Confire and their IT section, as well as our IT section, to expand the capability of platforms such as Tablet Command. We set up a CAD Fusion Center, so essentially we were CAD to CAD with all 4 dispatching agencies in the county, which is unprecedented. We worked with ISMA very closely to expand our protocols so we could provide the very best service to the community, really matching the patient's need with the facility we took them to. So we were really able to do a lot of very unprecedented and unique things, leveraging both technology and the skills or the tools that these other agencies brought to the table. That kind of sums it up.
A couple of other quick things that we did, very simple solutions. We use Survey 123 for a variety of things. I think most of the people who are listening will be familiar with that Esri product, but we used it for developing some employee health and wellness protocols, as well as to create the surveys to make sure that our personnel were following the policies that we put in place, such as temperatures, things like that. That really allowed us to bring that product interagency and be able to monitor the whole jurisdiction, but to also expand that product into the county of San Bernardino, who started using that to check the entire county's employee population daily for their PPE use and their temperatures. We also used some other documents that was able to immediately track PPE burn rates down to the fire engine level, which allowed our logistics to stay ahead. Now, I'm really excited to hear from Deccan, because as we move forward, the second piece of COVID that I think people are starting to talk about is the COVID economy. So with Deccan, we had a couple of things in mind. First off, if our workforce drawdown got to the point where we couldn't put as many units on the road, where would we be deploying those units? And now, as the economy is looming, we're looking at if there's any permanent closures of fire stations, where might we need to do that? What might be the best place? Where would we want to keep the resources? And then really targeting those calls that really matter to us, the fires, the rescues, and the higher priority medical aids. Thank you, Mike.
Thanks, Chief. And I'll note there that, the objective set, it sounds like there's a transition, you just spoke of it, from a response, which I know we're still in the middle of the response phase here, but into that recovery phase and that path to recovery put out by the governor's office and FEMA and Health and Human Services. Do you see your objectives shifting a great deal during that transition, Chief, and you're continuing to use technology to address that or assess that? Is that a fair statement?
So like any good incident management team, we build plans based on PACE, our primary, alternate, or contingent, and our emergency plans. And our incident management team did a great job looking out ahead, not only to the recovery phase, but looking at what happens if we have a second wave of COVID. What if it's worse than the first? What if we start getting into civil unrest, things like that. So certainly we have those plans in place right now as a county. I hope as a nation we're looking at that recovery. But in the back of our mind, we're waiting for a hammer that could fall again.
Excellent. Yeah, excellent description there, Chief. Thank you so much. So, the Chief mentioned some of the applications and technology San Bernardino was able to deploy to help them in both the planning and response phase and now moving into the recovery phase. And many of you that have attended these webinars or come to some of our events, we often discuss using technology to address emerging threats. And the fact that you can't just hire more firefighters, more paramedics, and build more fire stations at the drop of a hat. You have to have the ability to, first of all, assess, do that size up, and understand how your community is being impacted, and then use the technology to address resource deployment. And GIS is well suited, and obviously we've seen it nationally and internationally, and then down to the local level, like the Chief was just describing. So GIS, it's not just a map; it provides us the framework to plan, respond, and recover, and actually impacts your workflows. And the Chief described specifically the mobile applications, and that drives how we do the work, that drives how we collect the data, that drives how we present the data to the decision makers or to the responders on the ground. And so applications like Insights to be able to analyze the data, and visual products such as dashboards. And we've seen quite a few dashboards in place throughout, and the most prominent one is that Johns Hopkins University dashboard, but most of our federal, state, and local agencies are deploying some kind of visual product to help their command staff make decisions. That decision support.
Mike, can I jump in on Insights real quick? Because this is one of my favorite products that have been out for a couple of years now.
Yes, sir.
But Insights has the ability to take multiple spreadsheets and look for relationships between those spreadsheets of data, whether it's geospatial or whether it's phrasing or numbers. That's super important as agencies are looking to combine their response data with their CAD data, with public health data, with city and counties, and even financial data as we move into more looking at recovery of the economy. So Insights is a great tool for the County of San Bernardino to use, and it allows us to understand the relationships between huge amount of data that simply, as a fire chief, I don't have enough time in 5 years to look for those relationships that Insights could do in a matter of minutes.
Great description. Yep, thanks, Chief. So, GIS provides that right data to the right person at the right time, and that's really what we're trying to do. And we have excellent examples, again, from a federal level to a local level. And International Fire Chiefs, very early on, provided an impact survey, like the Chief was describing, using Survey 123, but they be able to understand the impact to fire and EMS agencies on exposed personnel that are quarantined, if their resources were taken out of service due to exposure to coronavirus. San Bernardino has an excellent hub set up, and you can see a screenshot of one of their dashboards there, but very clearly communicates important data to help you make decisions, and whether you're looking at hospital status or the spread of the virus itself within the community, and an easy way to do that size up, to do that risk assessment and understand how it's being impacted. And then a great example at a local level, the products on the right there are from Orland Park Fire in the Chicago area, and our friend Lieutenant Steve Rivero there, who's a longtime GIS manager for the fire service. But they very early on set up what we call the hub, and if you haven't seen the hub, you can go to our hub and take a look at one, and I'll give you a link to that very soon. But they were able to integrate multiple agencies into that hub site, much like San Bernardino did with their multiple agencies, and do things like post their incident action plans, their IEPs, to be able to put that field survey data from screening their personnel as they showed up at work and throughout a shift, put that into a dashboard view where the command staff could see that throughout a shift or throughout the operational period. And even tracking the PPE, and Chief Munsey spoke to that as well, but to be able to have a Survey 123 or some mobile application in the stations, at the facilities, to be able to have a real-time burn rate of what the PPE use was and understand where you might run into issues of supply chain issues for PPE. So it's an integrated system that allows you to bring together all these functions, and most importantly, understanding community risk. We can understand, what social distancing policies are doing and where folks are following it. Literally understand, where people are staying home and where they're traveling or where they're going to work on a day-to-day basis. Our policies reducing that risk through social distancing, modeling spread and impact, and understand, like we just described for San Bernardino, how it's impacting the community, and what are the impacts on the healthcare system? How's it going to, impact our hospital status day to day? And managing resources, and that's going to feed right into what Deccan's going to demonstrate is how do we manage resources with reduced personnel on duty, or how do we manage resources with an incredible increase in call load or service delivery needs, and then the ability to share the information with the public. That public information function is critical during all of this, and to have a site with verified data, verified information that the public can go to, that acts as rumor control, and they can understand where are my testing sites, what's the status of my community, what is the risk in my community, and have the public be able to go through that data and understand it on their own. So our hub site, go.esri.com/coronavirus, has multiple resources for you to use to support your community during a COVID response. It's updated nearly daily, and it's full of applications like we talked about the Johns Hopkins, and great examples like San Bernardino's hub site, but it also provides data sets that you can bring into your own products. So if you go and browse the data available at the COVID GIS hub, you can have access to that data to bring into your own visual products that you can use for your agency or your locality to build those products and provide that information. And another great location to get some additional resources for our GIS deployments is our solutions page, which is a long-standing site that you can easily, download these apps and add your data and start using them today. Well, there's a special section now for COVID, and if you go to solutions.arcgis.com, you can browse through those solutions as well. And it's, solutions to support the health community, health and human service professionals, and certainly our response to the fire and EMS agency level. And then that public information functionality is there as well. And what we're trying to do is be able to, report and track cases within our locality. We want to be able to model that disease spread and then predict capacity issues like hospital systems or PPE, and then what are our resource needs based on that assessment, based on that risk assessment, and then identifying the vulnerable population for things like where do we put testing sites, where do we, what kind of public outreach do we do based on the population present in our community, and all that data is available to you through either the solutions page or the GIS hub that we just discussed. So please take a look at that hub page. Please take a look at our solutions page, and we will certainly provide those links in the email after today's webinar. But what functions does it provide? Much like we talked about in Orland and Chief Munsey described, using mobile applications to get that data out of the field and to the decision makers. Understanding that we can take a mobile data computer, an MDC, a phone, a tablet, and in real time transmit vital data into either a dashboard view or a hub site to be able to provide that data to decision makers, and they can start looking at what are our resource needs, where are we having gaps in our resource deployment, and make adjustments for that. And protecting our workers. And I want to make a note that Chief Munsey and San Bernardino, one of their first objectives was to, continuity of operations and protecting the firefighters and paramedics on the ground. And we can have applications and data that support that from that hub. You'll see things like social vulnerability index and our at-risk populations, health coverage, census of the very old that are at a much higher risk. And all that data is available to you today. So, looking through that data, looking through the hub site, looking at the solutions page, and if you still need additional assistance to deploy some of these capabilities, we have our disaster response program, over 20 years of supporting significant responses, and this is by far our most significant. We normally support 300-ish responses a year, and we've already done 4,000 this year to date to describe the expanded services we're providing based on this. So certainly go to that disaster response program if you need assistance. There's a request assistance button on that page, and we can provide somebody to help you get set up or get started, with these applications to support your response to the COVID crisis. So I will turn it over to Jack, and he can describe exactly how Deccan's supporting these responses for fire and EMS agencies. Jack?
Hello, everybody. Mike, I just want to say thanks again for having us. We've been partners with Esri for a long time, and also partners with Chief Munsey and San Bernardino. They're using several of our products. For those of you who aren't familiar with Deccan, we're a software and consulting services firm based out of San Diego. We've been in business for over 25 years. Our solutions serve over 70 million people in the US, and we protect 1 out of 3 folks in Canada. We have really 2 core competencies when you think of our company. Our first is real-time situational awareness. Our solutions monitor real-time call for service data. They identify coverage gaps that exist because of high call volume, and they make move-up recommendations to cover those coverage gaps. Many of you online today probably are familiar with our Live Mum product that actually works in real time in a bidirectional interface with the 911 CAD system. Another one of our core competencies is complex data analysis. We use our solutions to help agencies examine what-if scenarios and also determine how they're performing against their internal benchmarks. So if an agency has a what-if type question, we have real-world empirical data analysis that we can provide them that lets them know, hey, if you do these or make these changes, this is the resultant impact on your service levels. So today we're going to go through 7 scenarios where people, our customers who are using our products, have actually asked us, hey, how do we deal with these scenarios in the pandemic that's currently going on? So we're going to review those scenarios with you today and define with you how we resolve them. So the first is managing budgets. The second is social distancing resources. Essentially, how do I physically separate my resources and keep them safe from each other? The third is how to project what increased call volumes could do to your response times. The fourth is temporarily closing a station. We're seeing lots of agencies have to temporarily close a station or take it out of service to either clean it or because of illness of resources and they can't fill the station. The fifth is dealing with a depleted workforce because folks are ill and how you can deal with that. Sixth scenario is how to plan for increased wait times at hospitals. And then the final one we'll be discussing is how to closing a hospital or adding filled hospitals can be done quickly and efficiently and understanding the impact to our service levels. So the first is managing budgets using empirical data. And we have Alex, who's done some research for us with one of our customers, and Alex is on to discuss with us some of the analysis he's done and the results. Alex?
Hey.
Hey, Alex.
Hello. So in this situation, the client asked us, we're going to be coming up against some budget situations where we may be asked to pull crews out of service, change the way we deploy crews, but also we're looking to still expand services. So it was kind of a challenge of looking and seeing how we could use some projection models to improve service while coming up against some budget shortfalls in the near and long future.
Okay, and what kind of data did you need in order to perform this analysis? Like what kind of data did you collect to actually set a baseline for the analysis you're going to perform?
So we set our baselines. We take historical data from the CADs that they record and place into their record management systems from any agency we work with. And in that case, we're able to take that historical data and make projections off of it and use it as trends for performance for any given unit type, given area. So we're taking highly informed estimates from previous performance.
So Alex, you could actually, use the products and the analysis for budget shortfalls, but also to request budget increases. Is that correct?
Absolutely. So in an example, you're a fire agency that only provides fire services, but you have a private transport agency that transports your patients from a call to the hospital, and you're investigating the opportunity of adding your own transport rescue units. So we could use our applications to kind of investigate, what is the impact on service by having these new units here in order to help justify asking for that funding and to try to stand up a program like that.
Okay. Chief Munsey, are you guys seeing, in the real world in San Bernardino, obviously you probably are seeing stresses on the budgets, 6 months, 7 months, 8 months down the line. And what kind of planning are you doing or pre-planning are you doing for potential budget changes?
Yeah, I hope that most of the chief officers are doing that for their jurisdiction. For us, we're lucky enough to be mostly funded by property tax, which is going to be, should be pretty stable for the next 3 to 4 years. There should be a dip in year 4 to 5. So we're looking at that. But we also have a large property tax that overlays our county that may be repealed in the next election. So those are two things that we're gauging. But being associated with the county of San Bernardino as a special districts, we also receive some general funding from the county's budget to protect some of the unfunded areas, the federal parts of our county, federal land. We're The county themselves are looking at a 5-year projection of getting to the point where they're losing $80 to $100 million per year in revenues. So that affects our operations greatly, especially in those areas that are unfunded, that they provide support to the district to provide fire stations and personnel. In addition, we have many cities that are under crunches with their general funds. The revenues haven't been coming in, and they're looking at reducing services. So we're working kind of regionally throughout our jurisdiction and helping those cities and looking at our fire department and starting to balance out how do we continue operations. To date, it looks like we're going to be able to sustain what we're doing, but it's important that we have those emergency plans in place, that we've had those conversations with our elected and public officials before the crisis hits. So from experience in our county, we tend to be not the richest county in California, I'll put it that way. We tend to look ahead, and we have shelf-ready plans. We have shelf-ready plans when times are good and we can add a station or add equipment. We know where they're going to be well in advance. We've already prepped our policymakers. We've explained to the plan. We show them our analytical software, Deccan, and why these recommendations are being made. But the reverse is also true. We're always planning on if there needs to be any closures, whether it's due to the economy or, as I mentioned before, if you have a degradation in your workforce, you have too many of your members that are infected by COVID and not enough personnel. What are you going to do to continue services?
Thanks, Chief. So I guess, in some for budget defense and justification, we have analytical tools and software and services that allows agencies to if there's budget shortfalls or budget cuts to understand what that's going to do to their response times. And if you also want to ask for a budget increase to cover areas where you think you have inadequate response times, we can help with that kind of analysis as well. Another question we got from a customer was, how can we physically, socially distance our resources, our vehicles and our staff from each other, and essentially spread them out throughout the county, as opposed to having them all report to one location? And if I were to do that and spread people out, how could that, what would that do for my service levels, how my response times looks? So Alex, can you discuss a little bit about the analysis that could be done using our products to deploy this kind of pandemic response plan?
Sure. So we have the ability to place a theoretical station with any combination of pre-designed units in any place that a fire department sees fit as a place to provide service from. So in the example on the right in the map, I've taken a city where I know the fire station is, and then I gave it, some characteristics, some places that could potentially house firefighters in the instance that that fire station had multiple units, so multiple crews, and they want to spread those crews out. So it's in a university town, so there's the athletic center and dorms where they could potentially look at housing them. There's a hotel nearby, but also some schools. And we could basically say, what if we move a truck here? What is the expected or projected performance that this area could, what will change? Is it going to get better? Could it potentially get worse? Is there a strategic location, if we're going to spread crews out, that can actually help improve our performance temporarily while we're dealing with this crisis?
So essentially you're creating, as opposed to maybe say 10 stations, you're going to multiply that and have 30 stations. You're going to crunch the numbers, deal the analysis, and determine what is optimal for your response. And you could probably have multiple scenarios, I'd imagine, of different types of places you could use.
Absolutely. So say a criteria in the city you work in is that the apparatus needs to be in a closed area. It needs to be behind a fence. Usually you keep your vehicles in a bay where it's secure. You maybe have a med box for your ALS units that are needs to be secured and cooled all the time. So you need to keep your trucks somewhere that meets a certain criteria. So you may only look at areas where you can secure your units. Alternatively, you're saying we need to make sure that we're limiting our response times to high-risk areas that have nursing homes or hospitals or places where we expect high call volumes to persist. So we're going to look at facilities that are eligible to house our crews and apparatus near those places to expedite our responses.
Okay, thanks, Alex. Another scenario that we've been asked to examine is how to handle projected increased call volume at a specific part of the community. So if you have a community that has a very, very large retirement community and lots of retired folks living in the same location, what would be the impact of having an increased call volume in that area, and also the likely decreased call volume in other areas because people aren't actually going out. They're not getting into accidents or falling. So, Alex, can you discuss a little bit of the analysis that was done to examine increased call volume in specific areas of a city as opposed to decreased call volume in other areas?
So we have the ability, much like we can play with where units are or where fire stations are, to take the projections of call volumes and kind of inflate or deflate based off of what we're expecting to happen. So in one instance that I performed, a city said if we surpass a certain amount of calls for service per day, we're going to redeploy our units to increase our ability to transport patients, because if we're reaching that number of calls per day, we expect that they're going to be EMS calls. In another instance, like what Jack was saying, we have certain areas that we know have a certain at-risk population. In certain cities, there are grouped areas for retirement communities. So you can select those areas, and in the map you could pick a response zone, so those little squares, and say we need to increase call volume for this area because we know they're going to have more EMS calls related to coronavirus, or they might have more other injuries. Alternatively, we're seeing people travel less on the highways, and so when we measure incidents along major interstates, we can actually deflate call volumes in those areas to kind of give a better representation of where performance is actually going.
So Alex, could you actually project this for the future? So in a future pandemic, if another one comes in the fall, could you actually develop multiple scenarios to say, hey, we want to increase call volume here, decrease it there, maybe create a hotspot over here, and actually have deployment plans that we put in place to move resources around the city to handle those scenarios?
Absolutely. So in the interim, we take this, the data we're collecting now that crews are creating as they work today, we can go and update the applications to kind of identify the trends and responses that occurred during this first wave. And if we're to project out and pre-plan out a second wave, we can use that information to our advantage. But even now, we can, if we know where calls may happen, or we suspect they may happen, or we are seeing trends at the moment that are suggesting calls are happening more here or there, we can create pre-plans with apparatus and change our prospective call volumes in the applications we use to study in order to effectively plan responses.
Perfect. Thanks, Alex.
Mm-hmm.
Hey, Jack, Dan Munsey here. Can I just put a thought out real quick back on the last slide?
Yep.
We keep thinking increase in responses, but I think a lot of agencies with COVID have seen a serious decrease of 20 to 30, sometimes even up to 40% on their call load. And this information is also good for planning where your stations may be slowing down in the future. For us, it's our large universities that have closed down. Now we don't have the student population there. So now we have excess resources that could be allocated to other parts of our various cities to ensure that we're providing a better ERF maybe for structure fires. And that's all something you could do with Deccan too, which is very interesting.
Thanks, Chief. It's interesting. You get those major universities with 10, 15, 20,000 people there that is now vacant. You have those resources that are sitting very close to it that are now not being utilized. So another scenario that we've been asked to look at from some of our customers is temporarily closing the station. So this could be because of the station is contaminated and they want to do a deep clean. You want to take it out of service for a week or two. And other times you have depleted resources. You don't have enough people to actually fill the station. So if you have to close a station or close a series of stations, what analysis could we do and help the agency understand, hey, if we need to close a station, which one should we close first? And if we have to close 2 or 3, which ones should we close without impacting response times, or at least having the least negative impact? And Alex is, Mike Moser's here, and he's actually done some analysis on this and has some summary information to discuss with the team as well on the analysis he's performed. Mike?
Thanks, Jack. Yeah, like Jack said, I'm going to talk about temporarily closing a station on this slide, and then our next one is essentially the same problem, just a different way that another department tackled it. So based on the coronavirus staffing concerns or apparatus concerns, what is a method and what does the data show is the least impactful in degrading of a response? So Deccan has a tool called Optimizer, which is honestly, it's usually used to add resources or add stations. But in this case, we wanted to do the exact opposite. So instead of the most impact, we want the least hurtful impact. So what does the data show if we need to close down one station? Which station would that be and why? And if we have to shut down an engine at another station, or what's the next station? And so in this way, the department has a plan in place backed up by data on why we need to close this station and what it's going to look like once we do. And then if our staffing levels keep getting worse, what's the next station? And what's the next station? So we have these graduating levels of staffing and station closures, and the department knows, has an idea and some data to back it up about what it's going to look like. So if you see on my graphic here, it might seem counterintuitive that there's some green on the map, but that's because another aspect of that optimizer tool is that as we reduce an engine or reduce a station, take it out of service, we're able to reallocate and reshuffle our deployment, reorganize in order to optimize our deployment now that we're down 5 engines or down 5 stations.
My question for you, if agencies are taking stations out of service, I assume in certain situations they're asking neighboring agencies to provide mutual aid. If that's the situation where you're entering into a mutual aid agreement with a neighboring agency because you're unexpectedly closing the station, how could you quickly update run orders to accommodate the stations that are mutual aid stations from another agency?
Sure. So we conducted a study, which is the exact situation you're describing, and we confirmed that we needed to recalculate run orders based on mutual aid and closed stations. Right. The first dues are all going to be shifted around now. So Deccan has a tool, it's called BARB, it stands for Box Area Run Card Builder, which essentially is going to automate the run card building process. So if you look at it in the situation where we have 10 stations and 100 zones, to create a perfect scenario, that's going to be 1,000 unique run cards, right? So the BARB tool is able to recalculate that without the human error, way noticeably less time, maybe 30 minutes to calculate those 1,000 run cards maybe. And then, so we did end up going down this route, and we created a run order for temporary use during the pandemic.
Got it. And then another scenario we have here is dealing with, one is closing a physical station, but the other is you have, less resources available to you because, 10, 15, 20% of your resources may be out or quarantine. What kind of analysis have you done to deal with depleted workforce?
Sure. First, before I dive into this, I want to thank Captain Williams of Louisville Fire Department, who's with us in attendance today, for his help and trust in us with this study. So again, related to reduced staffing, but a different way to tackle it. Again, we have these graduated tiers of reducing firefighter levels. So essentially, these different reduction groups. So for example, in reduction group 1, let's say we have to move engines 1, 2, and 3. They usually have 4 firefighters. Now they're going to have 3 firefighters based on firefighters being out of the fight due to quarantine or a COVID diagnosis. So essentially what happens here is for those calls that absolutely require 4 firefighters, we're going to have to start sending a second engine if one of the 3 firefighter engines responds first. So if you look at it in that way, that means we're essentially creating these new unplanned for responses out of thin air, where we normally could have accomplished this task with 4 firefighters, or with 1 engine with 4 firefighters, but now we're going to need 2 engines and 7 in order to essentially to fulfill the response plan. So Louisville Fire Department utilized these reduction groups, and in order to create a plan, again, with data and what's it going to look like for what their engine company response times are going to look like across 8 increasing tiers of staffing reductions.
Chief Munsey, have you guys seen your workforce, being depleted, or a significant portion of your personnel being quarantined or self-quarantined? And have you, obviously, you guys have done resultant, analysis on what to do. What's San Bernardino going through right now?
So thank God we haven't reached the point where we would need to close stations, but we did meet very early on with our union and discussed going to 2 shifts from a 3-shift schedule if needed. So our first thought was if we had 30 of our members that were infected and in quarantine at a given time, then that would be a decision point where we'd sit down with our labor organization and we would make discussions about going to 2 shifts from 3. And if 60 members became infected, we would immediately switch to a 2-shift schedule. So that was our first primary plan. That was accomplished through our meet and confer. And the second part of that is this exactly right here, is that if your workforce, even with 2 shifts, gets drawn down and you cannot maintain service on your engines, what are you going to do? And so using this kind of analysis is really important. Now, one of the great things with our incident management team going to interagency is that very early on, the different unified commanders decided that all agencies are going to support each other. That some of our smaller jurisdictions may only have 2 fire engines in their jurisdiction. And so an impact of 3 to 6 personnel in their jurisdiction could be catastrophic. How could the County of San Bernardino, how could we move one of our crews over there to support them while their employees were going through their quarantine period? So those are all examples of how we looked at a depleting workforce and how we might use Deccan products to plan for that future, but that's something that we haven't needed to enact at this time.
Thanks, Chief. The 6th scenario we're going to discuss today is increasing wait times at hospitals. You have ambulances that are being queued up because there's a high demand at ERs, and the ambulances have to be cleaned, so now you have the out of service times. Jamie Schwartz is here, and she's done some analysis for some customers on this very subject. Jamie, can you kind of describe to us what analysis you were able to perform using the Deccan tools?
Yeah, thanks, Jack. I'll just give a little bit of background on the origin of this analysis before getting into some of those specifics. So one of the things that we started discussing with a few different client departments was the fact that anytime there's a public health crisis, the relationship between hospitals and first responders is only going to become more intertwined. There's an enhanced need for tighter cooperation, for coordination in a multitude of different health and safety areas. One of those critical crossover areas is the response time impact that occurs when there are increased hospital wait times for ambulance transport, when hospitals are closed, and when temporary new field hospitals are being erected. The use case that we're talking about today specifically focused on using Deccan analytics to research what impact those hospital changes might have on an agency's ability to respond quickly to your highest priority emergency medical calls. So being able to understand and observe the consequence on response times that some of these pandemic-induced hospital changes will have means that public safety agencies can make better, more informed deployment plans. They can rapidly make decisions about what staffing is needed, what areas need more ambulances, and really measure what the true capacity is of their system to adequately deal with a massive outbreak. So for this use case, we wanted to include some of the other relevant factors that we've even discussed earlier in the webinar today that are at play during a pandemic. So things like traffic congestion were decreased by lowering the street speed limits. You'll see here that the streets that are color-coded in green indicate that traffic is free-flowing in those areas here on that graphic. And, that's certainly not likely to be the case in most of these areas when shelter-in-place orders are not in effect. And we did also lower the overall calls for service, an effect that Chief Munsey called attention to. So the overall calls for service were decreased with the exception of COVID-19 related calls for service in this analysis. So we also wanted to do this analysis of the hospital changes in 2 phases. In the first phase of the pandemic, we wanted to be able to measure a rise in hospital wait times first, as there's likely to be a longer lead time for facilities to be shut down or for new facilities to be open. So in the first phase, the actual time that it takes to offload a patient and return to availability is going to be impacted by a huge number of factors. This can include, busier emergency departments that are full of sick patients, which means that fewer hospital personnel are available to admit new patients being transported by ambulance. There are new protocols in place in some cities to safely transfer potentially infected patients from the ambulance to the hospital staff. And there may be less hospital staff due to illness among nurses and doctors. And of course, the ambulance crews must take the time to sanitize themselves and their equipment after offloading each patient. So to support this use case, Deccan worked closely in conjunction with a few different departments to identify what their concerns were on each one of those factors and to estimate the associated time delay for the factors they felt were relevant to their areas. These delays in our applications can be unique to each hospital. They can be common among all of them. But for the sample exercise I ran in front of you, we actually increased the hospital wait time by 27 minutes at the 2 hospitals circled in black. Once the
Jamie,
increase, sorry, Jack, go ahead.
Can you update, like, can you run multiple different scenarios as the department learns about what's going on and they become more intelligent on the pandemic's effect on the community?
Yeah, that's a great point. So these are analyses that can be run as needed over the course of time. And as Alex mentioned in some of his earlier scenarios as well, the more data that we gather during the course of a pandemic, the better prepared we are to make more informed decisions during the next version of that analysis. And so let's say that we were tracking wait times in hospitals for the first week of March, and we compared that when we were redoing the analysis at the very end of March. We could use some of the wait time data to make a better decision about the true wait times that were actually being observed and rerun the analysis to see the consequence of that.
Interesting. And then also you've done some analysis on the final scenario we're going to be discussing today, which is either closing a hospital because it's at capacity or propping up field hospitals to deal with the increased volume. What kind of analysis have you done, and what kind of tools did you use to deal with response time planning, just general planning for closing and or adding hospitals?
Yeah, absolutely. So these are potentially less likely to occur than the wait time increase that we observed, but we did want to go ahead and test out what the consequence of these might be. So when a hospital in a relatively urban area with other hospitals nearby gets shut down, you're probably going to see a different effect than when you're closing a hospital down that's in a rural area where the transport time to the next closest hospital is extremely high. That's probably the first biggest impact you're going to see when a hospital gets shut down. So it really depends on what type of area you're in when that closure occurs. Regardless, the biggest impact that you're likely to see from a hospital closure is the increased travel time to other hospitals in the system. A secondary consequence of that might be that the wait times in the hospitals that are remaining in the system are also going to increase. So in our analytics, we're able to take the transports that were originally associated with the closed hospital and redistribute them to the remaining hospitals in the system. Similarly, for opening a new hospital, even a temporary field hospital that maybe only accepts certain types of patients, maybe they're dedicated to the COVID-19 crisis, we can model for the transports of only certain patient types that are going to that hospital, which should theoretically relieve some of the wait time pressures on other hospitals in the system. Although again, we would account for the travel time both to that hospital and then returning back from that hospital that would need to be taken into account. And then just to wrap up on this analysis, one of the most important steps from doing this type of research is to then say, how do we mitigate against these changes? What deployment modifications do we need to consider in order to restore service levels to a pre-pandemic level or as close to it as we can get? And so with the recommendations from this particular analysis, we see that a new medic is being recommended to open near where the new field temporary hospital is open, and that we're actually recommending to relocate Medics 3 and Medic 5 closer to areas where response performance was most negatively impacted by the other hospital condition changes in the exercise. Thanks,
Jamie. Mike, that was those are the scenarios that we were asked to examine. Then we're getting a lot of these questions from our customers, and when we talked about putting together what we're being requested to do, this is the kind of questions we're getting from our customers, and these are the kind of areas where we can help our customers answer these kind of questions that they're dealing with right now.
And that's great, Jack. I think it's obviously very critical to have this kind of information to make, resource deployment decisions or workforce. How are we supporting our workforce and protecting our employees, as Chief Munsey was alluding to earlier. So we do have a couple of questions before we wrap up, and we'll start, Jack, aimed at Deccan, I believe. But when you add a station, does it attempt to evaluate travel based on the road network, or how do they estimate travel time?
So this is Jamie. I'll take that question. So we are, the travel time and the street speed network are a critical input into the analytics that Deccan is performing, and we can look at the speeds in a number of different ways. Although we start with a baseline street speed that's given in the GIS data that we're using, the actual rate of travel that a given piece of equipment is expected to take to travel to a particular call is actually taken into account. So let's say that we have a fire engine that's going to be responding to a structure fire call. We actually model that unit is traveling above the street speed limit, because they're not going to be, just traveling the speed limit. They're going lights and sirens. And so we take into account the baseline street speed limit, but we also make adjustments based on the type of apparatus that's responding and the urgency of the call that they're responding to get an accurate estimate of the true travel time needed.
Oh, that's great. So very similar question, I think, but what routing data did you use to generate response zones for that Louisville project that you demonstrated a few minutes ago? Was that similar?
Mike, I'm gonna have you take that one for us.
Yeah, to confirm, your question was, what was the routing data used?
What routing data did you use? Correct.
Yeah, so clients provide us with their street network, and then we work with them to, not just for Louisville, but for everyone, we work with them to make sure we have the most accurate and up-to-date street networks included within their applications. Because like Jamie said, it's of the utmost importance that when it relates to travel times.
Excellent. Yeah, as a previous customer, we've used those data sets pretty regularly to determine, where do we put command officers, where do we put a new medic. So obviously that's vital data to have. So we've discussed a lot of analytics with, say, RMS data or standing CAD data, but how can Deccan's tools be used in real-time situations where, it's a day-to-day change, or you need to make a decision in a few minutes, not a few days? How would you do that with real-time data?
That's a great question, Mike. So one of the ways that we tackle real-time issue of the moment concerns is by making move-up recommendations that temporarily reposition resources in response to some of these changes. So let's say, for example, that your hospital wait times have really increased, and there are a couple of call volume hotspots near a retirement community. In normal circumstances, you may have stations that are near hospitals or near retirement communities that you're not going to move up to cover very often. But in these kinds of situations where there's an infectious disease, there's a pandemic, you can have, real-time analytics that are dictating that based on these circumstances, we do want to move up and cover those stations. And so in that way, you're doing the best that you can to forward plan, but you're also taking advantage of real-time data to make issue of the moment decisions.
And you can pull real-time CAD data, not real-time, but true CAD data. You were discussing earlier about actual response times, not just posted speed limit data, correct?
Yeah, absolutely right, Mike. So we're connected in real time to the 911 CAD system to feed unit and activity data, but we're also using historical CAD or RMS data to inform some of the decisions that we're making. So for example, how long ambulances are typically gone on these calls during these types of conditions, and using that to make the best deployment decision possible.
Okay, that's great. And it's obviously very effective. So thank you for that. That's all the questions. I did want to thank Chief Munsey in San Bernardino County. One announcement I will make is Chief Munsey and the Couch Use Operations section won a Special Achievement in GIS Award this year. So Jack Dangerman, our fearless leader, will be issuing that to Chief Munsey sometime soon. I'm not sure with the schedule, the way it's going, when we'll get you in there, Chief, but we'll get it to you one way or the other. And I also wanted to, I'm sorry, Chief, go ahead.
It's quite the honor to accept that on behalf of the great people at the Cal Chiefs organization that have done all the really good work. I'm just the unlucky one that has to stand up there and accept the award. But thank you so much to Jack for even thinking of us to receive this award.
Yes, sir. Well deserved, without a doubt. And Deccan, Jack, and your staff, thanks so much for joining us today and providing this great overview of what your capabilities are. You'll see there on the screen, there's some contact information, both email and phone, both for Deccan and for Esri and myself. So if you have any additional questions, please feel free to email or call. And any questions that were not answered that were submitted in the chat and not answered during the webinar, we will follow up with an email to you for that. And that is all for our webinar today. So again, thanks everyone for attending and learning on solutions and workflows to help you respond to this COVID crisis. So thank you and have a good day.